Before starting the types of chronic inflammation, we'll talk about the acute inflammation and chronic inflammation, the major differences between these two. See, first one, acute inflammation, there is rapid onset. Rapid onset. Okay, that means usually in minutes to hours. Minutes to hours. These are very slow onset. Either it has slow onset in days, or may follow acute inflammation. Acute inflammation. First difference is this one. What is second difference? See, acute itself means it lasts for short duration. Short duration. They last for hours to days. Okay, and this chronic inflammation lasts for longer duration, for months maybe. Okay, for months. Let's talk about the third difference between acute and chronic inflammation. See, main difference it is the predominant cell is polymorphonuclear cell. Polymorphonuclear cell, all or neutrophil or neutro my god or neutrophils. They are predominant cells. They are the predominant cell. The predominant cell in chronic inflammations are monocytes or macrophages, we can say. Macrophages, lymphocytes, and plasma cells. What if there is neutrophil in the chronic inflammation? This often happens. I've talked about this in my previous video. This often happens in chronic bacterial infection. In chronic bacterial infection, most common example is of bone, that is osteomyelitis. In this condition, we call it as acute on chronic inflammation. Acute on chronic inflammation. Besides this case, in other cases of inflammation, we don't see neutrophils. Okay, what is the next difference between chronic and acute inflammation? Okay, in acute inflammation, there is exudation. There is what? See, we already talked about the phases, the events of acute inflammation. There is vascular events, that is exudation is occurring, exudation of fluid is there, and there is edema. Inflammatory edema is there. Inflammatory kind of edema is there. And what happens in the chronic inflammation? It is associated with, it's not associated with edema, but it is associated with proliferation of blood vessels. Okay, and tissue destruction is there. And fibroblast proliferation. That means these two is repair mechanism. So repair is going simultaneously in chronic inflammation. Okay, what else? What can be another difference? See, now the signs of inflammations are prominent. Signs of inflammation are visible or prominent. Now, what are the signs of inflammation? We all know the signs of acute inflammation. What are they? They are the pain, swelling, redness, and loss of function. Okay, these are the signs of inflammation, acute inflammation. But in the chronic inflammation, what happens is the signs are less prominent. The signs are less prominent. Okay. What are the next? What might be the uh, next difference between the acute and chronic inflammation? Next difference is injury and damage to the tissue. There is mild self-limited damage, mild and self-limited damage, but can progress to chronic phase. I already discussed the fate of the or the outcomes of the acute inflammation. But the damage in chronic inflammation is usually severe. It's usually severe damage is there because fibrosis is there and also scar formation. Also the scar formation is there. See, these are the differences between acute and chronic inflammation. In the previous video of chronic inflammation, I have talked about acute on chronic inflammation that is mostly happening in the osteomyelitis. But I have also forgotten to mention one thing in the previous video. Not only lymphocytes and macrophages, there might be other types of cells also in chronic inflammation. They are eosinophils in parasitic infection and allergy. Okay, and there might be other many cells like mast cells that also helps in allergy. Okay, and also the plasma cells which I have mentioned here. So we have completed the basics of acute inflammation and chronic inflammation. After this video we'll talk about something about granuloma.